Okay. Well, thank you so much, everybody, for joining us here today. We're just going to go over a few housekeeping items before we begin. For this webinar, the chat and the camera features have been disabled for attendees, but that does not mean we don't want to hear from you. As we've already discussed, we have some available Q&A options in the Q&A chat. And so please take advantage of that throughout the program. If you have questions anytime, please post them. They will get answered. And also, this program is being recorded and archived, and it will be archived in the MJHS Health System YouTube on our YouTube channel, which is MJHS 01. And that will be housed along with our previous Vet-to-Vet Café programs. And pretty soon, we're going to launch a quick poll just to get a better sense of our audience. So please do take a moment to complete that. And at the end of the program, there will be a short survey that pops up after you close your browser when the webinar ends. And I'd also ask that you just take a second to participate in that because your feedback is very important to us. I would like to thank MJHS and Toby Weiss, my supervisor and mentor, for her leadership, and TD Bank for the generous support for the We Honor Veterans program. And today's guests who represent the New York State Department of Veterans Services, and all my colleagues who work very hard here at MJHS and the Hospice and Palliative Care Department to work with our veterans and families. And thank you all for taking time out of your day to join us. So without further ado, I'd like to introduce you to Toby Weiss, Assistant Vice President of Cultural Diversity. Toby, take it away. You're on mute. I'm so sorry.
Okay. All right. I don't have to tell you who I am because Ashton already introduced me. I'd like to welcome all of you to another wonderful Vet-to-Vet Café. Today's topic is one that often is not focused on, yet it bears a tremendous toll on families. I speak about the challenges associated with caregiving. Though delivered with love and a sense of responsibility, there can also be fallout to those on the front lines of caregiving. Today, you'll hear from leaders in the New York State Department of Veterans Services. We're extremely proud to collaborate with Commissioner Reverend Viviana DeCohen, Mr. Jonathan Fishbein, General Counsel for the New York State Department of Veterans Services, and Dr. Lessie Branch, Special Assistant for Community Engagement. We'll hear insights, realities, and we'll learn about supportive resources and services to help navigate the caregiving maze. We'll also learn about services for veterans during illness trajectory, as well as at the end of life. I want to give a huge shout out of recognition to Mr. Ashton Stewart, our MJHS Veteran Liaison and Cultural Sensitivity Outreach Coordinator. Ashton is an accredited benefits officer, and he gives with his whole heart, day in and day out. I'm proud that he's part of our team and that he's with us at MJHS. He's helped so many veterans and their families as they faced end-of-life needs, and has become a helpful resource to our MJHS healthcare professionals, as well as professionals out there in the field, as they care for veterans while on hospice or facing the trajectory and not sure what's going on. Ashton will moderate this session, and I turn it over to him today. Ashton, thank you for all you do.
Wow, Toby, thank you so very much. Greatly appreciate it. It's an honor and a privilege to be part of the MJHS team, and even more so to be assisting veterans and their families. As a veteran of the Navy in the first Gulf War, I'm very passionate about this work, and anytime I'm able to help, I'm very, very happy to do so. So before I introduce the panelists and share a little bit about them, just want to talk a little bit about today's program, which is dedicated to caregivers. Today's November 1st. It's the first day of Veterans Month, and Veterans Day is coming up. MJHS is really looking forward to marching in the Veterans Day parade here in New York City to honor our veterans who have served in the military and those veterans who have served as caregivers as well. And we also honor the caregivers who have cared for or are currently caring for our veterans. Caregiving is not easy. The physical and emotional toll can push you to your limit. Taking care of a friend or family can be just as rewarding as it is difficult. Most of us are not trained to be caregivers, so the prospect of assuming these responsibilities can be challenging and scary. It is normal to feel uncertain or overwhelmed. NHPCO reported in 2020 that 1.72 million Medicare beneficiaries are enrolled in hospice care. and the majority of hospice care is provided in the place the patient calls home. According to a recent Kaiser Family Foundation poll, 7 in 10 Americans say they would prefer to die at home. This places a tremendous burden on the loved ones who are expected to become caregivers, sometimes overnight. MJHS is honored to be partnering with the New York State Department of Veteran Services today to talk about some key issues that include vulnerabilities caregivers face, importance of taking time for yourself as a caregiver, also known as respite, end-of-life services available through the VA, how to access supportive resources at the local, state, and national level for caregivers, veterans, and their families. We will hear perspectives from veterans caring for loved ones and loved ones caring for veterans. Today's guests include Commissioner Reverend Viviana DeCohen. Viviana was appointed in December 2021 to become the first female commissioner of the New York State Department of Veterans Services. A veteran of the U.S. Marine Corps, Viviana previously served as a commissioner of Mount Vernon Veteran Service Agency and assistant pastor at Mount Vernon Heights Congregational Church. She has dedicated her time and talent to assisting veterans, ensuring food, shelter, clothing, education, employment, and a little motivation, earning her the affectionate title of Mama V. Her military service allowed her to earn a bachelor's in behavioral science and a master's in health service management, both from Mercy College, where she received her start formally working with veterans and developing programs to enhance their academic and overall wellness. She is currently pursuing her doctorate in educational leadership and gerontology at Concordia University, Chicago. We also have Sheila Hahn, who is not affiliated with the State Department of Veteran Services. Sheila Hahn McLaughlin is a retired vice president project manager for Marshall McLennan Technology Department and survivor of 9/11. Married to and caregiver for Walter Hahn, a Vietnam veteran who over the past 20 years has had Alzheimer's and PTSD. Mr. and Mrs. Hahn were admitted into the MJHS hospice program earlier this year. We have Jonathan Fishbein, who is the general counsel for the New York State Department of Veteran Services. In this role, he is the lead on legislative priorities for the agency and manages legal needs and concerns in regards to laws, regulations, and proposed legislation for New York's veterans, service members, and their families. Previously, he ran a private law firm for 22 years. Mr. Fishbein is a trained mediator and arbitrator and served 17 years on the Board of Mediation Matters as secretary and later president. He is a former competitive ice dancer and for over 25 years held appointments as a figure skating judge. He earned a Bachelor's of Science degree in accounting from Fairleigh Dickinson University and Juris Doctor degree from the Benjamin Cardozo School of Law. He has also been a caregiver to his veteran father. Dr. Lessie Branch is the special assistant for the community engagement for the New York State Department of Veteran Services. In this role, she leads a team that supports public programming and initiatives for the veterans of New York State and their families. In addition to traditional outreach activities for veterans, her team is increasing efforts to reach women, minorities, and faith-based veterans. Dr. Branch joined the U.S. Navy in 1982 and served in various capacities. After leaving active duty in 1986, she served in the U.S. Navy Reserves, after which she enrolled in the NROTC as a midshipman, but decided to pursue a different career path. Dr. Branch is a public and urban policy scholar with a focus on racial, socioeconomic, and political disparities. She uses her skills, knowledge, and abilities to raise the visibility of human rights challenges and uses her public policy training to mitigate the disparities and create policy solutions to close these gaps. As an equity advocate, Dr. Branch works to make the invisible visible and exposing and reframing harmful speech and language in social policy and other narratives. She does this by helping people to think critically about how language assigns and transfers blame for inequity to those in the margins of society. She promotes social justice-minded education and restorative policies that advocate targeted economic, political, and social rights and opportunities. Dr. Branch cultivates strategies for individual and collective action for success. She will close us out today with a call to action and close up a few of the loose ends that I'm sure we're going to leave throughout the program today. But first, we are going to hear from Sheila Hahn, who is going to just tell us a little bit about her experience. I met Sheila shortly after her husband was admitted into our hospice program at MJHS, and I quickly saw how adept she was at navigating the VA support system. Sheila has incredible courage, and I'm so grateful that she's taking time to be with us today to share some of what worked for her to help her out to care for her husband. And Sheila, would you like to pick it up from there?
Sure. Again, my name is Sheila Hahn, Sheila McLaughlin. Um, Hold on one second. Let me pull up my scripts here. Okay. Um, as Ashton mentioned, I worked for Marsh McLennan in the technology department. So I started my caretaking positions started in 2003, and which was about when I myself started to return to the world after 9/11. You see, my company, Marsh McLennan, lost over 400 employees and consultants on that day. And I worked on the 96th floor, Tower 1, also known as the North Tower, as a project manager and in the technology department. I was late 15 minutes from work, made my way down to the towers after the first plane hit, and tried my hardest to just give me a minute.
Of course, of course.
I tried my hardest to get down to see if I could do anything to help my friends. But long story short, I was unsuccessful. Lots happened, and a little did I know in my life that my life would have been altered forever. But I won't get into that that detail too much. Right now, it's about my husband. That night at 2 a.m., I left my friend's apartment on 53rd Street and went right directly to my office in Midtown and got involved with the Marsh support team. I was there for 3 days straight and continued to support for more than 3 months or more. I've lost track of time. I attended memorials throughout the year and then some. Walter by my side up until a point where he had told me enough is enough. I told him it was fine. He could sit back. I still had to do my thing. He agreed. But at this point, again, it's not about me. It's about my husband, Walter. Walter was unable to know if I was sorry.
It's okay, Sheila. Take your time. And I just want to take a moment to let the audience know that Sheila was more comfortable with the camera off. So we're just having your voice, and our hearts are with you. And we support everything that you are sharing with us today. And I know
Okay.
it's easy.
I appreciate it. It's just kind of hard, but I'll be fine. Everybody knows me for being a crier, so anyhow, so my husband didn't know, he was unable to know if I was dead or alive until that afternoon when a friend was able to tell him that I was alive. He made it back home on the last train to Long Island and set up what he called a command center. He spent 3 days on the phone with his friends and family alone. He volunteered to help with the Salvation Army down at Ground Zero. He also volunteered to help Marsh take pictures for security ID for family members of the missing employees. That night after he completed his picture taking, he came to me and asked if he could see, if I could arrange to have one of our psychiatrist teams speak with him because he needed to speak to someone right away. I immediately reached out to the best person. Walter was with him for an hour and a half. Walter returned to work a few weeks later and had a full view of the cleanup from his office window. Every day he would report and investigate the progress of the cleanup. He couldn't help himself, as I would ask him not to, he would still insist he would. At the end of 2002, I began to notice something was terribly wrong with Walter. He is a man with an MBA from NYU, gone to Fordham University, and was the best test taker I ever knew. But now he couldn't pass his recertification test for work. Walter worked in compliance at the Barclays Bank downtown. He was in the 101st Airborne during the Vietnam War, 1968 to 70. He was in charge of the computer department located in Phubai. Besides his other duties, the computer department he was in charge of maintaining the data, computer cards, if anybody remembers those, on soldiers' data, dead or alive. When I determined something was wrong, I noticed there were notes everywhere in his room. After seeing several doctors, it was determined he had dementia, Alzheimer's, and his PTSD that may have been accelerated from the trauma of the 9/11. He became more depressed and his PTSD took off. Walter and I have been together for 39 years, 20 of them together, and in 2004, we decided to get married. Walter and I attempted to see if he was entitled to any benefits, not sure if he should pursue a claim or not for his PTSD. But once we discussed the matter with a fellow from the Long Island's claims department, who clearly discouraged Walter, whoever he was, he sounded like a boot camp sergeant, and Walter was a private again. Walter said he was never going back there. Now about me again, but I too was going through a lot at work and was struggling with my own issues from 9/11. I was diagnosed with depression and PTSD myself. And I was now dealing with Walter too. We managed in 2003, I guess it was, I've lost track of time, to get him set up in therapy from the VA for his depression and his PTSD. Walter was seeing a therapist in the local office of the VA in Long Island for about a year or so. He was on Prozac, Zoloft, etc., but it only helped some. His dementia got a bit worse, and he was forced to retire in 2003. And we decided to move upstate in 2007 to be closer to friends and for support for myself. He finally was able to get dementia meds, Aricept, Namenda, etc., from a private neurologist. After we settled into our new home, hoping for a fresh start, we started to get signed up in the VA in Goshen, New York, and Sullivan County, which was helpful. I was able to get the VA to supply his meds, but at a cost where I was very surprised. I think it cost somewhere between $10 to $25 per med. I'm not sure of the total cost, but it was significant. We took care of the bill, but I had no idea that I was going to have to pay for the meds. Either way, we paid it. From there, we met several doctors at various times as Walter dementia and PTSD worsened. It was then that we applied for VA disability. The process took a while and a lot of running around, but Walter finally received 100% disability for his PTSD and his dementia. In 2014, he worsened even more, and I couldn't manage the house alone, and we had to move to a 55 and above community here in Middletown. Took a major loss financially, but that was because of the market. After that, Walter's PTSD really got bad. During 2015, I was contacted by various VA people wanting to help and would tell me about different programs available to Walter and myself. In 2018, I couldn't manage Walter any longer, and he was admitted into Castle Point H1 unit. They were very supportive, really helped me out, and kept a close eye on Walter. I would go to see him every day at 12 to 6 and took care of his needs as well as the other vets' needs. I helped the staff when I could. Life finally became manageable for me, and Walter seemed okay as long as I was there to keep him going and doing what I was doing. On Sunday, March 8th, 2020, we were all celebrating in H1, celebrating Walter's birthday. I catered the food, had music. My friends came with a band. They played, we entertained them. It was fun for the guys as well as for Walter, even though he wasn't terribly aware of what was going on around him. Then on March 9th, I was contacted by the VA management that the hospital was shutting down and no one was allowed to see Walter or the other patients. The following week, New York shut down. You couldn't imagine how the next 6 months went. After 6 months, September 20th, 20, I was able to get Walter home with me. No help. Remember, had advanced Alzheimer's and was able to do nothing for himself. But I wanted him home with me. 2 months home, he was good and at least manageable. I believe he was happy. But then he got really sick. UTIs, stones, enlarged prostate, you name it. Crazy time for sure. VA home base was helpful from Monday to Friday, but was limited. Had two trips to the emergency room during the pandemic, scary and feeling so hopeless. It was time for the Orange and Sullivan Hospice to step in. Home base was still involved with the vaccines, visits, and medical supplies, but hospice was the go-to for Walter's medical needs. This was on for about 2 years, during which I was told about the caregiving program from the VA. I agreed to participate and went through the whole program process. It took a while, and I passed the test. No formal caretaking schooling, which is what I was expecting, but what I did know, I took advantage of. It was in March 2023 when we moved into the city because we had limited aid help due to the lockdown and the help from agencies upstate. And I also became so isolated that I needed to go where there was a possibility of finding an aid. New York was the place. We were requested to have our benefits transferred from hospice and the VA. Hospice wasn't a problem, but the VA was another story. I tried contacting the VA prior to moving, but was unsuccessful. I was told not to worry, things will continue from the VA, Orange County and Sullivan home base, and caregiver program. But 3 months later, I was told I need to contact the VA in New York City and transfer my benefits over to there. I tried, but when I was about to pack it all in with the VA, MJHS reached out. They were my lifeline. I explained my issues and my case. Their contact at that point put me in a better place. They put me in touch with several VA contacts, which were very informative. It took over 6 months, though, to transfer from the VA upstate to New York City. And that's only because I was persistent, and the help that I received from MJHS Hospice VA Advocate, that was his efforts and his input that helped me get along. It's 6 months in, and we're finally transferred to the New York City VA home base and primary and caregiver program, which was challenging. There should be how many wars later, something in place that makes a veteran and their families live easier. For example, when a vet moves from one location to another, the VA should be able to give the veteran a VA location option, and transfers should be seamless to a vet. Needless to say, that's not the case. Not sure where the problem lies. Also, I had issues with how the VA looks at some issues that a vet may have. They see black and white, never see the gray areas. I can't get into the details of that because it's going to take too long. We doubt we have time right now for any of that. But believe me, there are gray areas. What I can't imagine is, how do other vets manage their issues in this system when they have medical issues, emotional issues, and mental issues? Don't get me wrong. The VA system has come a long way since the 1970s, but the system still has many flaws. I was persistent, and I always met someone that could show me the right way. MJHS was one of them. During Walter's stay at the Castle Point, I was asked to join the Veterans Experience Committee, which is called the VEC. VEC team, excuse me on that one, which I contributed my input on many needs of the veterans that were in Castle Point in H1. We met through several variations, but ultimately the current team has had much success, and I'm still a participant when possible. In the end, I hope and I pray that there are other VEC system teams throughout the VA facility locations, and teams are willing to and able to make change, and the system that will benefit the other veterans that are in need. All I can do is say thank you to the VA and thank you to MJHS for all their help. Thank you.
Thank you, Sheila, for sharing all of that. There's so much history there. And one thing that is clearly resonating is your persistence in caring for your husband, who's already been through so much and re-triggered with the PTSD after 9/11. So difficult, so many challenges that you were facing that you were able to overcome. So thank you for sharing this. It's incredibly motivating to hear that despite all these odds, you have succeeded. I know that you shared with me earlier that the disability rating and the caregiver support, once you were eligible for that, those two programs helped you significantly. The VA's helped with giving you medical supplies. And once we got everything cleaned up and transferred from Hudson Valley to Manhattan, things got a lot better. There were a couple of hiccups. But yes, if there was a more seamless process when there is a relocation, that would be really, really great thing to continue on this conversation later. As the audience knows, MJHS is part of the We Honor Veterans program, which is in collaboration with the VA through the National Hospice and Palliative Care Organization. We've been a member since that national initiative began. So this is a good opportunity for us to try just to continue this conversation. So Sheila, thank you so much. If you could stick around or come back toward the end of the program, I'm sure there'll be some questions directed toward you. So thank you again. We're going to shift things over to Commissioner DeCohen, who has a phenomenal career supporting veterans and a phenomenal history also as a caregiver. I know that you're writing your dissertation on caregiving right now. You've got a lot of research. You've got statistics that are very concerning about caregivers, because one of the things that's not happening is they're not caring for themselves. So I'm going to give the floor to you to share more about that. Thank you so much for being here, Commissioner DeCohen. You're muted. You're muted, I'm sorry.
There we are. Thank you. Can you hear me now? Beautiful. Thank you, everyone, and great afternoon to everyone. Ashton Stewart, thank you so much. We have a long-standing history together, along with myself and MJ. To your amazing so much. I just want to acknowledge our team members that are on, our Jonathan Fishbein, our general counsel, also a caregiver who has a compelling story, as well as Dr. Lessie Branch, our special assistant. Again, a wonderful story and a wonderful gift of reframing. My caregiving journey began in 1992 after transitioning out of the military, returning to New York when I heard that my beautiful grandmother was given the diagnosis of Alzheimer's. Please understand that in 1992, we did not have the support or the information that we have now. We were told at that time to continually redirect the person and correct them. And that was just such a frustrating process that I knew something had to give, that I wasn't going to survive it. She was not going to survive it as we wanted. And so there was a lack of help. Living in the South Bronx, I've learned that even today, there are disparities and there's a lack of information. And when we lack information, we often perish. One of the first things that I learned is that there are people around us that we don't always tap into. There are neighbors, there are people in the clubs, societal clubs that she belonged to, and I had to tap into and make a circle around me. Did not have a formal name at that time. Now they call it a circle of care. I was asked by a social worker one day if I would speak to a new formed support group about caring for my grandmother. And this is how my caregiving journey began, as writing caregiver wellness programs and something that I developed called Real Talk. Once I began taking courses and certifications. And I want to tell you about the Ben Rosen Foundation, which is a wonderful opportunity for caregivers to not only learn about respite and care, but to take courses in caregiver self-care and courses on caring for your family members as well. When I began to look at research, and research back then was not Google, this was still going to the library, and I found out the astronomical rates of caregiver mortality. I'm talking about 53 million caregivers globally and 11 million Americans who are at risk for mortality. Ages 18 to 59, there's a 27% chance that you could die before the person for whom you're caring. 60 and over, that number jumps to 66%. Well, I was flabbergasted for two reasons, because I was a young caregiver at that time and my mortality rate was an issue. And then as I began to go around to the different hospitals that were inviting me to speak on my caregiving experience, I was seeing, Ashton, just how many people were suffering in silence. People were in tears. Everyone was not having the same experience. We had maybe 1 out of 10 that were enjoying the opportunity being reconnected with their loved one. Majority of us did not have information on the diseases that we were treating. We were treating everything from Alzheimer's in that circle to cancer to ALS, very harsh diseases. And we were living in with our loved ones. Please understand that even if you are long distance and you only visit once a month, you are a caregiver. Rosalind Carter, our former First Lady, she says that there are only 4 types of people in this world. She says that there are those who have been caregivers, those who are caregivers, those who will be caregivers, and then those who will need caregiving. And one of the opportunities that I was given was as a caregiver coach. The more I began to go around in circles and find other family members that needed this, I was given an opportunity to become a caregiver coach for the county that I lived in. And then more opportunities opened up at caregiving agencies. I want to share with you that I found that when we were talking in circles and joining with organizations like the Alzheimer's Association, they would often save me for the last speaker. They would show a movie that was made some years ago called Alice Doesn't Live Here Anymore, about a woman who had cognitive defects and Alzheimer's. And the family was just so patient in this movie. And I don't know if you have experienced someone asking you for 15 times in a row what time it is. By the 5th time, you're already annoyed, let alone the amount of times in this movie that the family was asked, what time is it? And this family in the movie, again, this is a movie, was so patient. Long story short, at the end of the movie, everyone was asked, what did you think about the movie? The audience said, oh, it's beautiful. They're stepping up to the microphone. It's beautiful. I'm having a wonderful experience with my father. My mother's this. Wonderful, wonderful. They have the panel on. The surgeons are on, talking about the disease, and everything's wonderful. And then they get to me and they say, well, Viviana, what did you think of this movie? And this is what began a segment that I call Real Talk, because the real talk was I was not having that experience, and that there were times that had it been legal to suffocate someone and just put them out of their misery and you self-euthanize, I would have been the candidate. I used to say, if I look better in an orange jumpsuit and shower shoes, I may have crossed the line, because there were times in caregiving when I was just so sleep deprived, especially when my grandmother began to wander and she began to have delusions and began to be angry and wanted to act out in her own rage. Real talk is, I would look out the window and for that split second think, if I could throw her up in the air and have God himself just catch her, and turn my back, I would have done it. My reality was that in a family of 26, I was the one that had to take this on. So what I had to do was to utilize the people that were around me. I found neighbors, I found old friends, I found church members, and I would ask them, when you're going to the beauty parlor, can you take her? And I would learn that during the time that the aide was there, not to be there. So often we say, a couple of hours, 2 hours, 3 hours is just not enough to go out and do anything. But the time that you have is the time that you need to take. There's so many challenges with caregiving. Caregiving support is necessary, but also self-care is essential. There's an acronym that I use that's TIME, T-I-M-E. Take time for yourself. When the person is sleeping and taking a nap, you take a nap too. You rest. Take time to eat well. I invite others to join you. Take time to meditate. Go for a walk. Even if the aide is only on hands for 2 hours, take that 2-hour time to yourself. And then E is exercise. Take time to move your body, even if you have the laundry for that amount of time. Do a couple bends with the laundry basket. But best practices need to be shared amongst caregiving groups. If you have a group within a community, the Alzheimer's Association, if you're dealing with cognition, again, the Ben Rosen support group, find a support group within the area for the person that you are caring for. And then there are resources with, again, Alzheimer's Association, Office of the Aging, the county departments for senior programs and services, and wherever you are, whatever that disease is, there's most likely a support group. I like the Ben Rosen Foundation because no matter for whom the person is that you're caring, what the diagnosis is, there's best practices that are outlined for you. There are caregiver resources that are aligned for you. I did this twice. I did this with my beautiful grandmother, and then I did this again with my wonderful mother-in-law, whom I brought home, and I had to teach and myself to speak up and to speak out and to tell my husband and my brother-in-law and the family members that this was not something that's easily done. We often make things look so easy. This is something that can kill you. That's mentally, physically straining, draining. The research is showing that a lot of caregivers, they self-deprecate. They're already losing sleep. Some of them negate their own health because they're so busy caring for that person, ensuring their doctor's visits, that they negate their own doctor visits, their own health. Eating properly, self-care is what I have to push and tell you, please don't feel guilty. There's a sense of grief that you go through and loss as the person is alive, as you're watching their life just change and transform, and that person transform before you. There is something called anticipatory and ambiguous grief, where you're mourning the person that you had, mourning the loss of the relationship that you had. My mother-in-law did not remember me. She forgot.
Commissioner DeCohen, you got muted somehow.
Yes, my wonderful mother-in-law had forgotten who I was. And so, with both my grandmother who was a world traveler and loved the arts. Both of them, I had to watch the decline of their cognition and their physical health. And so the anticipatory grief, the ambiguous grief, just knowing that the person is not only going to lose them at the end, but that you've lost them and that you're losing them and that you are in this world. So I have to tell you, self-care, self-care, self-care. The VA has a wonderful caregiver support group. They also have it through telehealth, wonderful programs that are coming up. Ashton, I believe I gave you that information. Again, the Ben Rosen organization for caregivers, no matter what the diagnosis of the person is for whom you are caring. It will teach you how to care for them, but also it will teach you how to take respite breaks and care for yourself guilt-free. Did I make the time, Ashton?
You certainly did. And I thank you so much. There was a couple of things that we talked about earlier, because we do have a couple more minutes for you. Something that was striking that we talked about earlier was Alzheimer's and how it affects people of color, and how there's such little funding in some of the communities where people of color predominantly live. And you've had to work your way around that sometimes with the aid and the support that you're providing those families. Could you talk a little bit about that?
That's right. Alzheimer's is one of the growing diseases that affects at high rates the Black and the brown community with the least amount of funding. The education in the communities are just not there. I went back to my old neighborhood, and still people there are still not aware of the Alzheimer's Association. There's no graphics for it. There are no discussions for it. I went to the houses of worship, went back to my old house of worship. They just do not have the information. And so these are the things that are lacking. It's at epidemic proportions. It really is. The amount of caregivers. I have a 27-year-old caregiver that passed away last summer, caring for her mother and caring for her uncle simultaneously. 27 years old. She dropped dead taking them to their appointment. And the last time I'd spoken to her, she had not been to the doctor herself for a physical in 3 years, 27 years old. So, these are alarming rates. Again, astronomical, 27% for ages 18 to 59 and 60 and over, 66% chance that you are going to die before the person for whom you are caring for. That's an epidemic. And because we're living longer, more caregivers are going to be needed globally. So this is something that not just for here in the United States, but this is a problem that globally that we're trying to find out, and we're utilizing and best practices and coping strategies to find out where are the best coping practices. What is it that some people are doing to have these wonderful outcomes and other people are not doing it? And if we don't do the real talk on the stress, on how stressed out we are, and if we don't speak up, then the numbers are going to rise, because the people that are self-medicating through alcohol, through eating more or not eating at all, even through anger, and now utilizing violence, elder abuse, those numbers are escalating, because people need help and people need the information and people need the support of support groups or a support caregiver coach.
Absolutely. And this is why this program is so important today, because the aging population is growing. The aging population in the veteran community is growing. We really have to have a serious call to action. And I know that Dr. Branch is going to share some of that with us later. But you mentioned some of the resources, and I just want to let the audience know that we will be sharing links and the names of these resources that we're discussing today. But I just want to highlight something through the VA, which is something that we've been able to elevate for many families, is they have a home health aid program for veterans, and they can give up to 16 hours per week. And they're very great at working with the families on filling in when those hours are most helpful, if they're in the evenings or on the weekend. And anytime we're able to secure that, up to those 16 hours per week, we always tell the caregiver, please take some time for yourself, walk around the block, run some errands, just get out of the house.
Just get out of the house.
To get out of the house. And the other thing is, like, most veterans are eligible for this, even if they've never been to the VA before, even if they've been told that they make too much money, or they have a pension, or they have securities and resources. All of that is out the window when you're terminal. You apply for the VA when you're terminal, you're going to be accepted, and they're
That's
going to
right.
help you. And
That's right.
MJHS also has a plethora of resources on our website under the resources for caregivers tab. I just want to make sure that people are aware of that, mjhs.org. There's a whole resources about caring for yourself as a caregiver, caregiving advice and information, caring for a loved one at home. There's all kinds of things there. But again, we'll be sharing these things a little later.
Good.
So I think we should turn now to Mr. Fishbein, because one of the statistics that you did include today, Commissioner, was that most caregivers are female. And we're so proud today to have a male caregiver who's been caring for his father. Mr. Fishbein, your dad served in the Navy, and you were the only person in the family able to help him out when he first needed the care. And he is also struggling with dementia too. Do you want to share a little bit about how that all fell together, and moving him into assisted living, and how all that just impacted your life? You're on mute. Sorry, we'll catch that right now.
Does that work?
Yes, sir.
Okay. Basically, at one point, my parents, when my mom was still alive, said that the only one of the 4 children that they thought they could live with was sort of preordained that at some point it would be me. My siblings really are not capable, because of what they have going on in their lives, to help. They're in different places across the state. And my dad was in Jersey most of his life after the military. And once we sold the family home, he went to apartment to apartment. As I started noticing him losing memory and the ability, he asked me one day, how do I write a check on Quicken? Now, my dad taught me everything I knew about check and Quicken and finances, and I walked him through the steps. He couldn't remember how to do it after I did, and 45 minutes later, we still had no checks written. So at that point, I started taking over his finances. And he was happy to have that off his plate, although always interested in, what was going on. But at one point, we realized he could no longer do his work. He still had a few clients. He's a rabbi and a marriage and family therapist. And we realized it was time for him to stop. And this was I think he was about 88 at the point. And it was difficult to get him to agree to move up. But when he did, we took him to an assisted living place, because we thought that would be a good place. Not assisted living, I'm sorry, 55 plus community. And he looked at me and he said, Jonathan, it's a good place to die. I can recommend it to some of my friends, but it's not for me. I tried to convince him it was his mother talking, but no luck. We bought him a single family ranch about 4.5 blocks from us. And I spent probably at least every other day. At some point, I was with him, taking care of everything from, I don't remember how to use my phone. I don't remember how to use the computer. I have this problem. And we realized it had gotten to an even worse situation when one day he calls me. I'm about 5 minutes from my home, and therefore about the same from his. And I hear this beep, beep, beep in the background. And he says, there's an alarm going on. I don't know what it is. I said, well, is there any smoke or fire? No, there's nothing. So I realized there's something definitely wrong. I go over I'm there within 5 minutes or less. And when I open the door, I see that there's a fire on the top of the stove. He had put hard-boiled eggs on to make them hard-boiled. And he forgot about it. So he's sitting in a house, the fire alarm's going off, the smoke, he's sitting in his Baca lounger, the smoke is down to about his hairline. And I said, Dad, there's a fire on the stove. And he starts getting up. I said, sit right where you are. Because if he stood up, he'd start breathing that acrid air. So he stayed there. I opened up the house. I turned on the fans. I put a blower in the window, cleared out the house. And at that point, I basically shut off the gas to the oven because I couldn't trust him to do that. And I started hard boiling his eggs. And I realized he could not really do his meals. So I'd cook legs and thighs, which he'd like, and I would season them the way he liked, and I would package them and freeze them so he could open up a packet, put it on a plate in the microwave, and he could do that. And things just progressed downhill from there. He wanted to keep driving. When he came up here, we arranged so that the insurance company was the bad guy rather than me. And that way we could take his license without him thinking it was the children or me taking his license. And I had to do that to preserve my relationship with him. And there were other times where when we bought the house, we redid the master bath so that he could get into the shower without having to go pick up his leg too far. Because there's usually a couple of inch barrier that you have to get up and over. And we were able to do it with no barrier. So as they're redoing the bathroom, my father calls me and says, they stole my ladder. And I was like, I don't think so. Why? He said, well, my ladder had no paint on it. There's a ladder in the garage, but it has paint on it, and that's not my ladder. Well, I happened to have bought his ladder, so I knew something about it. I went to see him. It was his ladder, and he wanted to know how it got paint on it. Where's his ladder without the paint? I said, Dad, when we bought the house, we had to paint the interior, and our painter used the ladder to paint the interior. Well, I don't remember that. And then he admitted, well, it seems I don't remember a lot of things. And that opened us up to a conversation as to what he remembered and what he didn't remember. And I was able to determine from that there was definitely some memory loss. And we started seeing a neurologist. The getting him help inside the house was basically difficult, if not impossible, because he didn't want, he wanted somebody there when he wanted them there, not when they could be there. And often that's an issue. You can no longer, at some point, you no longer have that kind of independent control. You're reliant on somebody else. So with a full-time job, I'm lucky that my job is such that if I need to, I can work well into the night. And sometimes I do. And the commissioner is great about supporting staff that way. And, sometimes I'll send her an email at 1 in the morning, and God bless her, she's still up and she's answering the email, because I think she is of the same mind. You do the work until it's done. but there is an exhaustion to the work. And I am blessed that I have a wife who's incredibly supportive. She went through caregiving to her father and then to her mother. And her mother passed during COVID, not from COVID, but during COVID. And I was there supporting her. And I learned a lot about how to support her and what she needed by often either asking her, because, you know, any man who thinks he can read his wife's mind is in trouble. And in return, she has been a wonderful support for me when I've needed a shoulder to cry on because I'm so overwhelmed by what I'm doing for my father, or because I'm just so tired. On the other hand, you know, it's easy to say I can take care of my father, but it's really a hard thing to do. And it's also something that I have, you know, there are times when he will get agitated and he will start barking at me. And I will, you know, my wife has a saying, once an adult, twice a child. And I realize that that's often very true with my father, that sometimes he will actually call me on the phone and he'll sound like a little boy. He's scared, or there's something definitely not right. And I'll go over and I will talk with him. And if he raises his voice or starts yelling, you know, I'll remind him that that's not acceptable behavior, and he wouldn't accept it from me, and I'm not going to accept it from him. And, you know, thank God he backs down. And I'm grateful for that. I've also learned that when stuff like that does happen and he can't back down for whatever reason, that I need to let it roll off my shoulder, redirect him. And a lot of that comes from the fact that I've been in therapy on and off throughout my life. Starting at about 16 when I didn't really like myself or like my inability to make friends and relationships outside of my skating world. And on and off when there have been times when my mother was diagnosed with 3 weeks to 3 months to live. We got 3 months out of her. But that was pretty sudden. I knew I was going to be in trouble if I didn't start working with somebody. So I found somebody right away, which is not something that's easy to do today. But back in 2006, 2007, it was much easier. And on and off, I've been in therapy for various reasons to get a skill set that has now given me the ability to deal with my father and let things roll off my shoulder. And, you know, the value of having a wife that's so supportive is really important. My siblings may see this, I don't know, but I will say that I understand that they don't have the ability to help. It's frustrating, it's sad, because I think they'd get a lot out of it, but it's not something that they have the ability to do right now. So it's on me, and it's something that you don't go looking for it. But what I'm trying to do with Dad is I'm trying to get him to tell me stories that he remembers, and I'm recording them. And I'm recording them because some of them are damn funny. I'll just leave you with one, and that is that he was a chaplain in the Navy on Guam. And although he went to the officers training school, nobody ever told him who the ensign was or what the ensign was. When you go on board a ship, you're supposed to salute the ensign. My father's looking for the man who is the ensign, and what it was is the flag. You're supposed to salute the flag. And the flag is referred to as the ensign. There's also a rank of ensign. And my father was always looking for the rank, not the flag. So he never saluted the flag. And that morphed into one day the commander, the chief of the chaplains is on base, and the commander's giving me a tour, and my father walks by both of them and doesn't salute. And the commander says, that's Fishbein. And the chief of the chaplain says, he didn't salute you or me. And he said, Fishbein doesn't salute anyone. In fact, I don't think he would salute God. And it's those kinds of things that make taking care of him a better experience than it would be otherwise. They're few and far between, but when you get them, they're gems that you can tell your children, and they can tell their children about their father, their grandfather, their whoever. My heart goes out to Sheila with all she went through. But, all caretakers have, I think, a very hard task. At the same time, from my experience, if you can get counseling, if you can be in counseling while you're doing it, it is a tremendous help. I've been fortunate to have really good crackerjack people to help me throughout my life, and give me a really good set of tools that I can call on when I need them when trying to help my dad.
Mr. Fishbein, thank you so much for taking part today and sharing some of this. I mean, finding support is so imperative. You were able to find yours. You were also able to figure out how to start letting things roll off without getting agitated. I know we spoke a little bit more in depth about that when the dementia really started happening for your dad. It was hard for you to like redirect your energy and how you felt and how things made you feel. And you've done a tremendous job. And I just really thank you for sharing your story today and his story. And building a legacy with these memories is wonderful. And at MJHS, we're crafting a legacy program as well to work with families to share some of these memories. We have some of that building through the We Honor Veterans program, but we definitely want to expand it. So maybe that's something we can talk about at another time. You've got some great ideas. And I just want to say, Mr. Fishbein is the architect of bringing the very first New York State Veteran Cemetery to New York. And that's something that just opened this year, and we really thank you for that. And your whole department is so caring and dedicated to improving the lives of veterans and their families. And emailing at 1 a.m. is just proof in the pudding that you are in it to win it, and we appreciate you very, very much. And I just want to say one more thing about dementia. It sometimes brings about PTSD in veterans that families aren't even aware that the veteran has, and it's because they have the weakened mind, the state of mind is weakened, and suddenly PTSD is resurfacing, and they can sometimes feel like they're back in combat, and that can be very, very challenging for families. So please be aware of this and know that there are resources out there, especially through the We Honor Veterans website and beyond, and certainly through the VA. And we are going to turn now to our final guest, Dr. Lessie Branch, who is going to bring us home and talk a little bit about what we can do to be better prepared and how we can have some sort of a formation or assimilation of a call to action. So Dr. Branch, the floor is yours.
No, I appreciate you, Ashton. Thank you. And everything that has been shared today just really highlights the best of humanity as it regards caring, right? Caring is a choice. Love is a choice. And I'm glad that those in this webinar choose to do it for those that they love, whether they be blood or not. And so the call to action is simply this: what can I do? Right. And so when we think about that, there are three core tensions in that question. So what can I do is a question of personal readiness, right? And there are things that we can do to prepare ourselves to be caretakers. Asked another way, what can I do? Is a structural question, and that critiques the ability to counteract structural and societal problems. As the commissioner raised, in some communities, there is a dearth of information and resources. And then asked another way, what can I do? Is inquiring about strategies. What strategies can you put in place to address the paucities that exist, or the questions that we can do to, divide the labor that goes into caregiving. And so what all of this is about is context, nuance, and framing. And all of those things matter. And because they matter, as always in caregiving instances, you need to know what is important to you, right? You need to know your values, and you need to frame them, and you need to articulate them. Your perspective in this matters, and you have to ensure that you are heard. And so adding to that, when attitudes and when rhetoric about challenges don't really match, right? So when the commissioner spoke about, there was this lovely film that was shown about Alice not being home, and she's watching it, and she's like, well, that's not my reality. So when reality and rhetoric don't match up as it regards challenges, those who have the ability to give resources or to help, they cannot and often will not deploy those resources if what you are saying isn't matching what is in fact happening. And so make sure you speak up, because you want to have help, and help will only come if you articulate it and you frame it in such a way that lends itself to helping people to understand that you need help, right? And so sometimes you need to articulate a thing. Sometimes you need to say a thing before you see it, right? And I would like to quote Amanda Gorman, the poet laureate, in her poem, The Hill We Climb. And in there is a line that says, quiet isn't always peace, and the norms and notions of what just isn't always justice, right? And so it becomes incumbent upon you as individuals and collectively to articulate what it is that you need to be able to ask for. And in my final, parting shot across your bow, if you will, there are a couple of books that I would like to recommend. And the first one is this one. It is by George Lakoff, and it says, "Don't think of an elephant, know your values and frame the debate." Again, words create structures and they create frames, and whoever frames the better structure or the better narrative generally ends up controlling, or at least having the power to decide who is going to get what, when, and how. And the final book, of course, is one that I authored, Optimism at All Costs. And it talks about a term called paradoxical ebullience. And that means simply being happy or expressing joy about something when every shred of evidence tells you that you shouldn't. And so then it becomes important to make sure rhetoric matches reality, so things can be in alignment and resources and help can be brought to bear. And that is my call to action for the gathered today.
Thank you so very much, Dr. Branch. That was very well said. And we are going to be sharing those notes along with the resources with everybody, and the recording, of course, in a few days. But now I would like to offer the opportunity for questions and answers. If there's I saw, I've been looking at the Q&A. I haven't seen anything. I've answered a couple, and mostly I know that we have a national audience, and there's some people from outside of New York. Every state has a Department of Veteran Affairs or Department of Veteran Services. Sometimes they have different names, but they are all equipped with benefits counselors who are there to assist you for free to evaluate veterans benefits options. And sometimes they can help navigate other services and things. In New York, for instance, we have a indigent burial reimbursement program through the State Department of Veteran Services for those who are down on their luck, to give them a dignified burial. They can be buried in a national cemetery. The cost will be paid for by the state, and they will be placed in a national cemetery and not go to a potter's field. The state of New York also has a blind annuity. It's a monthly payment for anybody that's legally blind. There's so many different benefits that are out there, and sometimes there's local benefits too. There's federal benefits through the VA. These are things that really need to be explored, and the best way to do that is to speak with a benefits counselor, or through the VA directly. And Commissioner DeCohen, we are waiting to get a couple of thoughts here or questions, but I wondered, do you have any closing thoughts that you would like to remark on for today?
Yes, I just wanted to tell people, especially those who are in the healthcare field, please ask the family, if they don't divulge the information, if the person is a veteran. My grandfather was in a civilian hospital, and no one asked him. And it was not until I came back to New York and I said to my aunt, "Wasn't Grandpa in the Army?" And she says, "Oh my God." She said, "Yeah, but I'm not sure if he qualifies for anything." And I said, "My grandfather's a veteran. We got his paperwork. My grandfather qualified to be in the veteran's home."
Wow.
And then let me say for those of you also who may have family members in assisted living, check the aid and the attendance benefit. It's best for you to check than just say, "No, I know I won't qualify." When I was in the assisted living arena, those on the verge of having to move out, we got their aid and attendance package together, and they not only qualified for benefits for themselves to be able to remain in place either at home or the assisted living, but the spouse gets a check also. And so it could be up to $2,400 for the veteran and up to $1,800 plus for the spouse if the spouse needs care as well. So aid and attendance, please don't let that benefit go. And then, as I said before, please take good care of yourselves. I owe my doctorates, my coming doctorates, to my mother-in-law, because had I not taken that respite break to go back to school, again, if I look better in an orange jumpsuit and shower shoes, Ashton, I almost, and I may have. So take care of yourself. Like Ashton said, when the aid comes, even if it's for an hour, if someone can sit and half an hour, just go outside, take a break. Please don't eat while you're working, while you're tense, while you're stressed and your one fist is balled up. Please take time to relax. Take time for good mental health. Take time for physical health. Take care of you. Put that oxygen mask on you. People say it, and I know it's difficult, but listen, I learned how. And when I heard that I could die, my best friend just died last year, being in the same rehab as her mother, and going up and down in the rehab, caring for her mother. She suffered a heart attack. and dropped dead on the floor, and the mother was pressing the button. Tell my daughter I said to come here. And they went to my girlfriend's room, and she was dead on the floor. And the mother is still here, and she's gone.
I'm so sorry to hear that.
Take great care.
Oh, wow. You know, one of the things I just wanted to add to veteran status, we've encountered so many veterans that feel that they don't qualify even as the veteran in name. And that could be for a number of reasons. Maybe they were kicked out, or maybe they had a other than honorable discharge, which is something else that the New York State Department of Veteran Services can help out with and get you upgraded to honorable and get state benefits, including eligibility for state-run veteran nursing homes.
That's
However,
correct.
the point is, rather than asking, are you a veteran? Sometimes for those vets, if you say, did you serve? In the
Have you
military?
served?
Have you
Right.
served?
Have
If it's
you
1
served?
day or 100 days, it
That's
doesn't
right.
matter.
That's right. There are eligibility factors at every level. If you've completed boot camp, you're eligible for something.
That's right.
If you've just been to a duty station if you have worn the uniform and done this, go to the VA and get a benefits checkup and tell them I've served, and ask them, what am I eligible for?
Awesome. Yes, ma'am. Yes, ma'am. Sheila, I know that you're still with us. Thank you so much for sticking it out. I just wanted to offer the floor to you to see if you had any final thoughts or wanted to share anything else. I'll give you a second.
Yeah. Well, listening to everybody's story, it was very touching. I just want to add that my experience has been for 20 years, and my husband is still going. um, and that's because I took good care of him. And yes, you're absolutely right. You need to take care of yourself, because my remarks constantly to friends is, I'm going to die before he does. And that is definitely something that I've thought about. And yes, I've neglected myself over the years. And I plan to try to get hold of that again. But again, I completely sympathize with everyone. But there are very, very good stories that, you can hold on to. And I've always said that I started a book. I plan to write down all my good thoughts and good times that we had throughout the years. And we had many, many years together while he had this disease. And I will share that one day if I'm still alive.
I will be the first to purchase it, Sheila. I think that's remarkable. I didn't know you were doing that, and I applaud you and encourage you to get that finished. And speaking of bereavement, this is something the commissioner mentioned earlier in one of our conversations, that the earlier you can start your grieving process, the better. Just to be prepared, prepare yourself. There are bereavement supportive services through MJHS, and there's other programs, of course, that offer similar support. But just be ready.
Not to interrupt. I've gone through this many times so far, and it's never easy, but you get used to it after a while. And I think I've somewhat become numb to my daily routine. Check to see if he's breathing, see that he's still alive. Okay, life continues. So do I.
Absolutely. And MJHS is here for you, Sheila. And, I'm so honored to have gotten a chance to meet you and come to meet Walter and honor him with the veteran recognition ceremony. It's the little things that we can do just to support each other through these difficult times and challenges that come before us. If there's closing thoughts from Jonathan Fishbein or Dr. Branch, if you'd like to take a moment, we've got 5 minutes left. I've seen so many heart emojis and thumbs up from our audience today. Really appreciate you being here, and there's more. It's really moving. It's really, really, really moving, and I thank you all. So stick around. We'll be doing another program next quarter. I have no idea what it will be about, but it will be something similar, end of life care, just to help make it a little easier. So thank you so much for taking the time to join us today, everybody. And we wish you a very thoughtful and happy Veterans Day. Take care, everybody.